Hey, I'm Dr. Hillary Heschauer from Rangeline Chiropractic. I'm so glad that you're at the office. A lot of patients ask me, what can I do to get better results in a faster time? We're in a society where we're very fast paced. We've got kids' things to do. We've got a lot of work. We've got family life. What can I do to get better faster? Well, I have a whole bunch of ideas for you. It all involves listening to your chiropractor. But seriously, a lot of your symptoms and problems didn't develop overnight, so unfortunately, I can't fix them overnight. I wish that I had magical hands, and I sometimes joke about that, but the fact is that it's going to take a while to fix things because they didn't develop overnight. Some things to keep in mind. We do prescribe you a care plan for a reason. A lot of you might be coming 2 or 3 times a week for several weeks. This is because we need that amount of time to actually change the structure of your body and retrain your muscle memory. If you've had some muscles that have been tight and you've had some symptoms and some nerves being pinched for weeks, months, or even worse, years, keep in mind it's going to take some time to fix. So things that you can do at home. We will, if we haven't already, recommended some appropriate stretches for you. We'll do some stretches in office with you to make sure that you know how to do it, because I found that people don't do the correct stretches, or they do it really quick. They go, oh yeah, I stretch my neck all the time. Not at all what I want you to do with your neck. So we will work on stretches with you and then eventually work up to correct exercises. So we do put in your care plan 1 to 2 sessions of exercises to make sure I know that you're doing it correctly and you're holding it the correct amount of time and that your spine looks like it's in good alignment while you're doing it. So there are reasons why we do that. So when you're at home, what can you be doing? Definitely the stretching. But what about that water intake? So when we do adjustments and therapies in the office, it does release toxins from your body. Drinking enough water will help flush out the toxins and allow your muscles to relax. So the rule of thumb is around half of your body weight in ounces. So if you weigh 100 pounds, we're looking at 50 ounces of water per day. Ice is also going to be your friend. I know everyone loves heat better. Sometimes for some people, heat inflames things and makes it worse. So just ask us if you're wondering, do I use ice? Do I use heat? The rule of thumb I will say is ice. Ice will generally not make anything worse. However, heat sometimes can make things worse, okay? There's also some things you can use at home. I'm not a big fan of anti-inflammatories and medications. I like to use more natural things. So I love Cbd Sav and oil. So we do have at the office, my favorite is the Mahalo brand CBD oil, and you take that under your tongue. And then if you haven't used it in our office yet, we can definitely do a sample for you, but there's a salve, and I love putting that on the muscles, especially at night. These things, when you're in a lot of pain, you can take these like 3 times a day. The great thing is, if your body doesn't need it that day, it will just excrete it. It's not going to harm your liver or do any other damage like some of the other prescription drugs. So we've got the resting when needed, ice. Just kind of listen to your body. There's no point to overdo it and over-exercise when you're in pain. So I find that walking is generally fine for everyone, but the running and the heavy lifting, you might want to like back down a little bit or give yourself some more rest days. Another thing we can do in office to help you is do therapies on muscles. So we've got things such as the dry needling. I love that to help reduce the tightness in your muscle. That works really fast. So if we want to get a great result fast or in a lot of pain, dry needling is my number one. I love doing the neck massage and neck traction and the cupping. These things reduce the muscle tightness, which will allow the adjustment that I just did to hold in place better. So if we're too tight, the adjustments will just they'll just quickly move back out of alignment. Like at sometimes like 24 to 48 hours, it can move out of alignment. But if I can keep the area around the spine loosened, it will have a better chance of staying in place. So again, if we want better, quicker, faster results, it would be to do the therapies, do the home stretching, do the exercises as prescribed. So we've all heard about like gratitude journaling. What about journaling how you feel? How did you feel before you came into the office and started care? How have you felt 1 week into care? What are things you couldn't do before? Sometimes writing in your journal, like, I couldn't walk the dogs more than 2 blocks without pain, or picking up the kids was too painful. It was too hard to give them a bath at night. Writing those things down, and then as the days go and the adjustments progress, we will both find that you're able to do more, walk further, maybe exercise more. So we can look at that too. Also, sleep is a huge factor, right? If you're not getting enough sleep, maybe we need to journal too how many hours you're getting of sleep and how restful you felt. Because with chiropractic adjustments, it actually will help you get into a deeper sleep cycle because your nervous system is functioning better. So what it does is it allows your parasympathetic nerves to relax you, calm you down, and help turn off that switch at night to sleep. So if you don't sleep on your pillow correctly, this could actually hinder your results. So when you're sleeping, the best way to sleep is on your back with a good pillow that has a dip or something like this. So this pillow would go behind your neck and you'd be sleeping on your back. Let's just say you are a side sleeper. Great. Keep in mind though, when you're on your side, this arm and shoulder does not go under your pillow. You could bring this arm straight down, or my favorite is to hug a pillow when you're sleeping on your side. So definitely do not put your arm under the pillow and sleep on your shoulder. And then the worst case is sleeping on your stomach, because when you're on your stomach, your head is turned, your arm is up usually, and that really plays a factor into your neck and upper back. What it does is it literally strains your whole spine and all the nerves going down your back. So even if you think, I don't have a neck problem, it's just my back, it still plays a part in your low back. And when you're on your stomach, it puts like an extra curve in your low back. So we definitely don't want you sleeping on your neck. Sorry to burst your bubble. Also, tell us and communicate with us if you're not doing as well as you had hoped, or if, let's say, you hate hearing your neck pop, or you hate the little activator tool. We have like 5 or 6 different ways in the office that we can tailor and customize it to you. So if we're not getting the results, we can switch to what we call a different technique. So we've got the manual where we push on you and you hear your neck pop and snap. We've got different activator tools. We've got an arthrostim tool. We've got the tables that like pop up and drop down. So I guarantee there's a way that we can find to help fix you and get you better faster. But often we don't know unless you tell us. So please communicate with us if you feel like you don't like something, or hey, you just want to try something else. You've heard some popping and snapping in the other room and you're like, I wonder what that feels like. Honestly, just ask us and we can try different things to make sure it's the right fit for you. I feel like every body is not the same, and so everyone shouldn't have the same treatment plan. If you are thinking during this whole care plan, hey, I wonder if my spouse or my parent or my child would be a good fit for this, just say something to us. We can do just a quick talk and see like if someone else that you love and know is experiencing some symptoms, especially if they're similar to you, like kind of what we can do here. Conversely, you might think, hey, my child or my mother gets chronic ear infections. I wonder if chiropractic can help. Yes, we can. But the main point is ask us about it, because there's a lot of things that we do here that you probably don't know about. So please feel free to communicate with us. Let us know, ask us questions. We love questions. We just try not to bore you with how much chiropractic knowledge is out there. So remember, pain is the last symptom to appear and one of the first ones to leave. Just because the pain left doesn't mean the problem's fixed. And I think with our society, we get too caught up with, well, I'm out of pain, so I must be healthy and fine, right? But pain isn't the indicator whether someone's healthy or not. So make sure you communicate with us how the rest of your body is feeling, and we will tell you kind of objectively when you're on the table, hey, this stayed in place, or, oh, we've got some work to do on here. How many times have we said, wow, this is tight. Did you know how tight you were up there? I mean, that happens to me when I get adjusted too. So don't worry. We will just objectively tell you how you're feeling, as well as you tell us subjectively that you're feeling better, doing great, and we're all going to work together to get you better, the best results, and the fastest way possible. Thanks again for choosing Rangeline Chiropractic.